Clary, and I'm a second-year pediatric hospital medicine fellow. I'm going to take 2 minutes to introduce you to a resource that's available for you to use during our week on service together to teach learners evidence-based medicine. You'll start off by going to your web browser and searching for sohmlibrary.org. This will bring you to the section on hospital medicine library, and you will reach the resource by scrolling down on this web page until you get to the items that are shown here. You'll then click on the item that says education, which will bring you to the next screen where you'll see a button of teaching scripts. You'll click on teaching scripts, and that'll bring you to an entire library of scripts that are available for you to recognize teaching moments and then apply evidence-based medicine to those teaching moments. And we'll go through an example of these by clicking on the one that says feeding in bronchiolitis. Once you've clicked on that, this is a very typical outline for one of the teaching scripts that you can use this week. It starts by giving you a trigger to identify, which would be when one of the learners, whether that's a medical student or an intern, reports that a patient is still not eating because they're on high-flow nasal cannula to treat their bronchiolitis, and it gives you a one-liner high-yield teaching point that patients with bronchiolitis who are eating and drinking actually recover faster from their disease and have shorter lengths of stay without increased aspiration events, which is the big highlight here. And then it gives you a couple of sources to back up the information that you're sharing to your learners. Both of these come from Hospital Pediatrics 2017, so both very recent publications. And then it gives you a teaching strategy as well, which is to make your team members put it to a vote, essentially asking everyone on the team, would they vote to feed the child? Is that safe to do on high-flow nasal cannula, or is it not? So I think that this is a great resource that you can utilize throughout your week of service to recognize and provide evidence-based medicine teaching points.